enhance their presence by learning presentation, promotion, and persuasion skills. But I also work with some selected companies whose products I deeply admire, whose testing is peerless, and to help them get their messaging across. And today I'm honored to be able to do that for a company called LifeLength that's located in Spain. They are the premier laboratory for the testing of telomeres. To learn more about them, you can go to info@lifelength.com. So let's get started. Now, many of you, I would assume, are integrative practitioners, and I think with the training programs that we've had through A4M and IFM and AIHM, we're doing a pretty good job helping our patients. So let's look at a typical patient. This is your anti-aging patient, and you've done a great job. You've got his weight down significantly, 280 to 210. Body fat is markedly reduced. Cholesterol cut in half. LDL downward should be, HDL up. Triglycerides have come down. A1C is within the normal ranges. You've helped this person with inflammation. Their hs-CRP is a normal range as well. And from a cardiovascular perspective, their MPO and LP-PLA2, the tests that look at inflammation in vessels, they're also back down to normal. So great job. But here's my question for you. How do you know that you've really anti-aged this patient? In fact, all of the markers that you've just seen are essentially surrogate markers. The only way to really know the extent to which you have anti-aged this patient is to do what? Is to examine his telomeres. So in this session today, what I'm going to do is provide a brief overview of telomere science. Let's look at some of the literature regarding how this is used in diagnosis. We'll look at prognosis and lifestyle management. But probably most importantly, we'll describe the current methodologies for how we assess telomeres and telomerase. And then we'll explore the potential for enhancing telomerase. There are some new exciting things happening in that dimension. And then, again, and this is where I like to see all of this great science turn towards the patients, we'll discuss the ways that you can incorporate telomere testing into the clinical practice of medicine. So let's get started. The causes of aging are many, and perhaps the best study was put out by Dr. Maria Blasco. She is one of the most renowned scientists in Spain, and she's the director of the National Cancer Research Center. I like this model. The causes of aging, well, let's go from around 11 o'clock. Cellular senescence, stem cell exhaustion, altered intercellular communication, genomic instability, telomere attrition, epigenetic alterations, the loss of protein regulation, proteostasis, deregulated nutrient sensing, and mitochondrial dysfunction. So the causes of aging are many, but there seems to be one of these factors to which many of the others are inextricably linked, and that is telomere attrition, because telomere attrition drives cellular senescence, stem cell exhaustion. It drives the communication we have between cells. It can drive genomic instability, and it is dramatically affected, both positively and negatively, by epigenetics. Well, my guess is you've probably heard about telomeres. It'd be hard not to. There's been 20,000 plus publications on telomeres. There have been 4 Nobel Prizes awarded. Most of you are familiar with Elizabeth Blackburn's 2009 Nobel Prize. And if we look at the articles that are coming out in the literature, perhaps 40% are cancer-directed, 24% stem cells. Aging and anti-aging are taking on an important role. Diabetes, cardiovascular disease, CNS. So we see that telomeres are very tightly linked to many of the disease conditions that so affect our patients today. So what are telomeres? Well, they're the protective end caps on the end of chromosomes. And they are basically little snippets of non-coding DNA, T2AG3. And what they do is, with each cellular division, they shorten. But what happens is they are there essentially to protect that genetic material from mutations. However, once those telomeres get to a certain length, they stop. They go into replicative senescence. They no longer divide, and essentially that cell dies. You heard about the Hayflick limit. This was work done by an American physician, Leonard Hayflick, who in the 60s basically set and established a limit. The fact that cells can divide 40, 50, 60, maybe 70 times, 40 to 70 times before they stop proliferating. Interestingly enough, this was, he had contradicted the previous Nobel laureate, Alexis Carnell, who basically said, well, you know what, cells are immortal. Well, they're not immortal. We start out in utero with about 15,000 base pairs, or 15 kilobases. By the time we're born, this is down to about 10,000 base pairs, or 10 kilobases. And you can see that as we age, we lose length of our telomeres, any place in 50, 100, sometimes 200 base pairs a year. And while we're not exactly sure where senescence sets in, once you get to 3 to close to 3.5 kilobases, cells usually cannot continue to replicate after that point. So we know that short telomeres are correlated with increased age, and that's important. Now, how do we measure them? The tests that we do today are basically leukocyte telomere lengths. We look at the lengths of the telomeres in the white cells. And you can see from this study that was done in 2013, the leukocyte telomere length correlates very well with muscle, with fat, with skin. So it's a good representation of organ health. So why should you care about telomeres? Well, the adverse consequences are significant. The loss of tissue renewal capacity, the failure of stem cells to divide in sufficient numbers, a poor immune response. And if you look at these 20,000 articles, we see that short telomeres accelerate the onset of age-related diseases, cardiovascular and metabolic diseases, certain cancers, CNS diseases, arthritis, osteoporosis. We can find short telomeres associated with each of these conditions. Now, what are the criteria that you use to select a telomere test? And I believe there's 3 of them. The first is, does the test provide median, and to highlight this very significantly, telomere length, and a specific quantification of the number of critically short telomeres in each cell? Reliability. Is the test accurate? Within 5%. And finally, when you get that report back from the lab, will that report help you educate your patient? Will it make your job easier? Or will it just present a snapshot that is very difficult for you to explain? Now, the problem with just looking at the average telomere length is well represented by this 18-wheeler. So if we had one critically low tire, and the driver took the average of the 18 tires, he would be falsely reassured. Because what we do know is that the shortest telomere, not the average telomere length, that's what's critical for cell viability and chromosome stability. So short telomeres are critical. What we have to do is we have to be able to visualize and be able to quantify the number of critically short telomeres. Unfortunately, most of the big studies, the big population studies that have been done with just average telomere lengths. And while this is helpful, perhaps for getting a snapshot of a population, it does very little to help guide you with an individual patient, because it does not really indicate critical cell viability. The shortest telomeres constitute the dysfunction, and they limit survival in the absence of an enzyme called telomerase, which we're going to discuss a little later. So you can see in this snapshot, here's the median is 10.1, but if we look at the short telomeres, these are 4.1 kilobases. Now, there have been many methods for measuring telomere length. Starting out in the 1988s, they started out with a a blotting technique, terminal restriction fragments. These have progressed. So today we have some very sophisticated mechanisms. I'm going to talk about several of these. I want to talk a little bit about qPCR, about flowfish, and about high-throughput qFISH. Now, qFISH, FISH stands for fluorescence in situ hybridizations, and it's the most sophisticated of these tests. So let's look at them. qPCR. These are what you see in the very large studies. It's inexpensive usually. You can process multiple samples. But the only thing you gain from a qPCR test are the average telomere lengths in a population of cells. So you're just looking at a population. Now, flow cytometry is another mechanism. And there you are able to look at the average telomere length per cell. But then again, it's just an average, and it represents the entire cell. With high-throughput qFISH, the blood test of life length, their TAP tests, you are able to actually look at the individual chromosome lengths within a single cell. And that's able to tell you the median and the mean, and really look at the number of short telomeres. There's also a technique that LifeLength does called telemapping, which also allows them to look at tissue and what takes place in tissues. So these are the commercially available tests today. This is a great picture because when I visited LifeLength and took a look at my own telomeres, and what you see is this fluorescence. These fluorescent probes are basically hitting each of the chromosomes, and the extent to which they light up tells you how long or how short those individual telomeres are on the chromosomes. So this is LifeLength's Telomere Analysis Technology. And they're really the only company in the world able to measure the percentage of short telomeres in individual cells. And they look at 50, 100,000 cells to be able to calculate both a cellular and a biological age. So it's a simple test. You don't need to fast. You only need 10 mils of blood. What LifeLength has patients do is complete an anonymous online questionnaire, and the report is available in multiple languages. It takes about 3 weeks. The physician receives the results of the patient's samples in about 1 to 3 weeks. And from this, LifeLength is generating a very significant database because right now what we are doing is we are comparing the individual to himself versus having a standardized database. But the more test results that LifeLength has, the more they're able to generate a better and more sophisticated normative picture on telomeres and telomere degradation. So let's shift now in the last 15 minutes to how do we use this test in clinical practice. The first is that it is an advanced diagnostic tool to improve patient care. It can be used, really, think of it, to risk stratify patients. And you want to identify those individuals who have accelerated biological aging. So we know from the literature that reduced telomere lengths are found in patients with atherosclerosis, hypertension, obesity, diabetes, smoking, physical inactivity, stress, chronic infections, and short telomeres are associated with poor survival. One of the interesting things that came from the literature was the study done in the British Medical Journal, and a significant study in which they concluded that telomere length is an independent risk factor for cardiovascular disease. So we've got smoking and a sedentary lifestyle and hypertension, and right up there is short telomere length, which is independently correlated with risks for cardiovascular disease. We see a very significant positive association between shorter white cell telomeres and type 2 diabetes risk. There was a large study at Harvard Northwestern that showed that abnormal telomere attrition can actually predict cancer. So if you are looking to help your patients gauge their cancer risk, you're following them, they've got a strong family history, this is definitely a test that can help predict cancer well before cancer actually appears. We see that there's telomere shortening is a mechanism to explain the phenomenon of age anticipation in hereditary breast cancer. Working on cancer, LifeLength has received a $3.1 million grant from the European Union. They've been selected among thousands of companies to carry out a multi-year study in oncology, where they're looking with the public hospitals in Madrid and looking at the telomeres in a variety of cancers. It's called the OncoCheck project. They're very honored to have received that, and this will be a significant contribution to the literature. Another way to use telomere testing is to personalize therapeutic interventions. Perhaps we can reverse or slow down telomere loss. And how do we do that? Through lifestyle modifications, through supplements, stem cell therapies. So this is the test that is actually the scorecard to see whether or not your therapeutic interventions are working. It can enable early intervention, lifestyle modifications, helping patients reduce stress, oxidative damage, other inducers of accelerated telomere loss. And here's where the literature is also very exciting, because we can see that many of the positive lifestyle modifications that we do have a buffering effect on the rate of telomere degradation. Elizabeth Blackburn's work showed that exercise has this positive, powerful buffering effect. The Mediterranean diet, we've looked at that in the nurses' health study. This was another positive factor. Nurses who had a Mediterranean diet had a slower rate of telomere loss. There are associations between antioxidants, such as lutein, vitamin C concentration, and the Austrian stroke prevention study showed this. Omega-3s, again, another great reason to take omega-3s to reduce oxidative stress and to increase and to slow down essentially the rate of telomere degradation. Meditation, mindfulness, another buffering effect of the effects of stress on telomeres. Now, there is an enzyme called telomerase, and it is an enzyme that repairs and lengthens telomeres. Now, in the absence of telomerase, telomeres shorten every time these 50, 60, 70 divisions, they shorten. But the problem is telomerase, for the most part, is normally only present in germ and stem cells, and it's also what gives cancer cells their immortality. They become immortal through the upregulation of telomerase. So there's a great deal of work being done to see if we could identify any compounds that could essentially enhance telomerase activity. There was a very small study that was done by Dean Ornish. I'm sure most of you are familiar with his work, and also Elizabeth Blackburn was on his paper. And they looked at the Gleason 6 men who had prostate cancer and who adopted watchful waiting. And they found that those men who were in the lifestyle intervention group actually had increases in their telomere length. So this is interesting. You've got a group of cancer-positive individuals. They've elected to be on a program of extreme lifestyle modification, diet, exercise, meditation. And in this case, they have lengthened their telomeres. Interestingly enough, LifeLength would participate in a study that was done in Spain with 117 participants, a randomized double-blind placebo-controlled study for an astragalus product that is purported to activate telomerase, which repairs telomeres and exerts a rejuvenating power. And this was a published study. What they did was they looked at individuals who actually were positive for cytomegalovirus. So by the time you're about 50 years old, about 70 to 80% of people will be positive for CMV. So this actually does decrease T-cell immunity. It does tend to lead to immunosenescence. It tends to expand the CD8, CD28 T cells. And they followed these patients for 3, 6, 9, and 12 months. And in the placebo group basically lost 290 to plus or minus 100 base pairs a year. The low dose, and there was very little difference between low and high dose astragalus, these individuals actually lengthened their telomeres by 530 plus or minus 180 base pairs per year. So this was a significant finding that it may well be possible to enhance telomerase to counter some of the degradation of telomeres with nutraceutical products. Perhaps the last real reason to do telomere testing is it's your scorecard. It is your ability to monitor a patient's biological aging over time. And really it's the ultimate scorecard, because if you do this test yearly on your patients, so you start out with a baseline. Now that baseline in and of itself can be helpful in terms of compliance or adherence to a lifestyle program. Patients who actually see their telomeres. In fact, in the life length TAT report, they actually get a photograph of their leukocytes and the extent to which they're lit up. And they get significant information on lifestyle change in order to help them comply with wellness and anti-aging programs. So over the course of several years, if you track this annual rate of change, you can begin to see how people are doing. It's interesting, I was just speaking with a colleague who has had his telomeres tested for 3 years. Did well the first year, staved off much degradation. In the third year, he took a significant 500 base pair loss of telomeres. And in speaking with him, he said, you know what, I had so much stress that year. He went on and told me about a significant illness he'd had, illness in the family. So stress, lifestyle, illness basically took down his telomeres. He's then actually getting on a program for telomerase enhancement to build that up. So I think it does give you this opportunity to compare you to you, to not just a general population database, but in this movement towards a personalized healthcare, this is perhaps maybe one of the best tools we can have. And it can help engage your patients and shift the balance of responsibility from you fixing them for them fixing themselves. So in summary, the life length TAT test can help you stratify patients and identify those individuals, the ones you need to worry about a little bit more with accelerated biological aging. It can help you enable early intervention and lifestyle modifications, perhaps help a patient reduce stress, inflammation, oxidative damage, and some of the other inducers of accelerated telomere loss. We want to be able to help our patients with therapeutic interventions that slow down and reverse telomere loss. And this is a way to tell whether our supplements, the stem cells we offer, even optimal donor selection for transplants, these are all ways that telomere testing, provided it can tell us the critical number of short telomeres. It can complement other testing, so traditional testing and genetic testing. So we get that full picture, that full predictive prognostic picture of disease, and we can take action accordingly. And finally, the ability to measure longitudinally how our patients are doing year over year. We can monitor the effectiveness of wellness and anti-aging programs. So Life Length has some great materials on their website. They'd be glad to send you more information. If you have any questions or thoughts, you can reach Life Length at info@lifelength.com. I'm Dr. Mark Tager. We've got a few minutes left. If there's some questions, go ahead and type them. I'll be glad to pick up a few of them and answer them to the best of my ability. I hope you found this to be a valuable use of your time and provided you with a better understanding of this exciting technology. Okay, great. So I think we'll sign off. I mean, it's dinner time on the East Coast, and it's going to be dinner time soon on the West Coast. So thank you very much for your participation, and enjoyed having this opportunity to chat with you. Take care.